The world's worst child health crisis is malnutrition, and every year the estimated cost of undernutrition is $3 trillion in productivity loss. These are the words from the just released Goalkeepers Report brought out by the Bill and Melinda Gates Foundation. In this exclusive interview with CNBC Africa, Bill Gates, the billionaire philanthropist and co-chair of the Gates Foundation, joins us from Seattle in the US to help us address the question, how do we better invest in global health? Mr. Gates, it's an absolute honor to be speaking to you here today. Your foundation has been addressing the world's greatest inequalities for over 2 decades now. And in the 2024 Goalkeepers Report, there are some really stark figures. You talk about the world's worst child health crisis, that is malnutrition, and that no country, however rich, is immune to it. The numbers are that 400 million children aren't getting the nutrients they need to grow and thrive. And more than half of all child deaths still occur in sub-Saharan Africa. How are you still managing to be an optimist in all of this?
Well, as tragic as it is that over 5 million children die worldwide under the age of 5, a significant majority in Africa, that number has come down. At the turn of the century, that number was double what it is. And so the Gates Foundation uses this General Assembly meeting in New York every year to kind of highlight both the progress and the challenges of helping the world's poorest children. And this year, I think very appropriately, we're focusing in on nutrition. A lot is known, and some of the interventions are very low cost, like more vitamins for pregnant mothers, has a very substantial benefit. So in addition to highlighting, really making sure we're measuring everything, we highlight the very low cost approaches. Vaccines have been the main reason that we've cut these deaths in half. And now we want to complement the new vaccines with the new understanding we have about nutrition and, both help mothers, and help young children with food so that not only do they survive, but even among the survivors, their mental and physical potential is fully achieved.
So child mortality has fallen by 50% in the last 20 years, but COVID-19 has certainly derailed a lot of the progress that the world has made. You speak about the health boom 10 years ago, and now what are the new breakthroughs that you're seeing? What do you think are the kind of investments, that increased investments into nutrition, to prioritize nutrition, that you're calling for at the moment?
Well, the Gates Foundation, always focuses on both upstream innovation. So we're the biggest funder of the research on the microbiome and what goes wrong when kids get malnourished. We actually look at childhood deaths. So we take thousands of deaths in Africa and do in-depth form of autopsy. And, that's where we see this statistic that malnutrition is part of the cause in over half of those deaths. And so, we trialed giving pregnant mothers more vitamins. Historically, it was just iron and folic acid. Now we have a supplement that's only a couple dollars more expensive that this Children's Nutrition Fund with UNICEF that's one of the things that they'll help finance. And, so we have innovations, then we have to deliver those innovations. And I will say that the death reduction went very quickly until about 3 or 4 years ago. And now the progress is really stalled. And there's three reasons. There's the pandemic. Well, the good thing about that one, it's over. The second reason is that the interest payments of these African countries on their debt is forcing them to cut even very meager health budgets. And finally, aid levels, which actually did go up until about 4 years ago, in many cases are going down. And we see this as we're trying to raise money this year for the vaccine fund. We won't be able to raise as much money as we did last time. How much of a cut there is up in the air, which that means lives we can't save. And then next year we'll have global funds. So the research, I'd say that's all positive. There's still more to learn about malnutrition, but we've learned enough about which micronutrients are missing, and cheap vehicles like adding to salt or oil or wheat. That's called large-scale food fortification. We've learned a lot. We've also learned that kids getting protein, which mostly means eggs and milk, that's very important to their diet. And so a lot of our work in agriculture is, okay, why do some chickens make more eggs than others? And can we get those chicken genetics everywhere of these highly productive chickens? And that, when I was in Nigeria and Ethiopia last week, both countries, I spent time on our livestock work, which has made huge progress on that chicken genetics and chicken health work. And, that'll be complemented by work on other sources of protein, including cow productivity.
So a lot of new agricultural technologies. You mentioned your recent trips to Nigeria and Ethiopia, where you interacted with a lot of young people. That really is the future of the continent. This is the continent with the world's youngest population. But what is the kind of innovative thinking that you're seeing on the ground in terms of R&D in coming up with these new technological innovations? You mentioned a few of them, but also to increase dairy productivity, to help farmers on the ground, to even reduce crop wastage. That also you also speak about the microbiome, the bacteria of the gut, and that as a next new frontier. What is the kind of innovative thinking you're seeing among young people on the ground in Africa?
Well, it's really, when we do these trials, it's scientists in Africa that are behind them. The idea of women, particularly pregnant women, are suffering from anemia. We did a trial to see if we reformulated the iron supplement, if you could use a single infusion rather than before, the best we could do was 6. And when it was 6, nobody was going to do it. The cost, the time, the capacity just wasn't there. But now that we have the idea of taking women with severe anemia and a very low-cost test, and it was a doctor in Nigeria who actually led that trial. She came and spoke at Goalkeepers last year and continues to do trials for us. We try out these interventions. So this multiple micronutrient supplement, we had pregnant women who had it and pregnant women who didn't. And we saw, even though the cost is a few dollars per pregnancy, that much better outcomes both for the mother and the child when you added additional micronutrients. And, so people's picture of malnutrition, when you say that, they'll often think of periods of famine and starvation. And those are awful, and, they do come up. But 90% of malnutrition is just year in and year out, that your diet is limited enough, even though there's no macronutrient famine going on, you're just not getting the right things, or you get inflamed in your gut, so you can't absorb the nutrition. And it's these understandings of, okay, what type of micronutrients are missing, or if you can increase the protein, do you get out of this state where your gut's inflamed? So I applaud the scientists who help us run these trials. That's been true as we come up with new vaccines. When I was in Nigeria, although it's not nutrition related, we celebrated the fact that they'd gotten the HPV, the cervical cancer vaccine, out to a very high percentage of children. And, often primary healthcare delivery in Nigeria is not high quality. It's not as well funded as it should be, and there's a lot of execution challenges. So when Nigeria actually does some primary health thing really well, we applaud that. It sets a good example, and there's some good people there trying to improve it. But right now, particularly up in the north, whether it's nutrition or vaccines, a lot of the kids aren't getting the latest innovations, and so we're always limited by innovation plus delivery.
Mr. Gates, you're always meeting with heads of state and ministers, and particularly in Africa. What is the kind of political will that you're seeing to accelerate change in global health, opening up capital for change and improving health outcomes?
Well, I know the Minister of Health in Nigeria, Dr. Pate, very well, and so we talked about how we adjust to the very limited resources and what the priorities should be, and making sure that we're only picking the right locations and how we measure the work. In Ethiopia, I got to meet with the Prime Minister, and he's always prioritized health, as their country's return to stability, getting all the health capacity restored has been a big thing, and they're making really good progress on that. In Ethiopia, we've made real progress in having a data system that lets the people there look and say, okay, where are we getting the vaccines out? Where are we not? And we were a big partner in that, but it's all, great kids from the university who now are totally running this data system and able to see, okay, are the vaccines in stock? And if not, what do they do? So it's great to see, the primary healthcare in Ethiopia is the execution is quite good, even though, overall they're a fairly poor country, but they do prioritize it. And there's some lessons for other African countries on how that's been done. So yeah, I meet with ministers of health wherever I go. Sometimes I meet with the head of state. I did talk with President Tinubu. He was in China for FOCAC, so it wasn't face to face, but he took the time to make sure we were talking about the challenges they face and how we can help them.
It's very heartening to know. You also work with Aliko Dangote, Africa's richest man. You're good friends with him. What is your work with the Dangote Foundation that's focused on nutrition?
Well, the Dangote Foundation and the Gates Foundation work in Nigeria, I'd say are about 75% overlapped. And, so we learn from each other. Obviously they understand Nigeria, we understand the microbiome. And so that's complementary. Aliko's in an intense period in terms of, his new refinery and all that, but he still, the whole time I was in Nigeria, he, made time, and they have a great team at their a very professional team. We work together mostly on primary health care. And, whether that's finishing the polio job, which is challenging. They have a new initiative called Crown to help the women who are primary health care workers, and they designed that, but we're a supporter of that work. And so it's mostly in the north, which is where the primary health care delivery is still nowhere near what it needs to be. And, in a time when the Nigerian budget because of debts and the way oil subsidies work. There's very limited money, and making sure that we're designing the health system so that it can operate on the limited money and still have high quality execution. We had a lot of good discussions that Liko Dangote was in most of those. Dr. Pate was in most of those. We also met with the agricultural people about chickens and milk and seeds that'll increase agricultural productivity, because these countries, as their budgets are so tight, the idea that they're going to raise food productivity is one of the clear things, so that they're not importing as much food and creating opportunity in the agricultural system. So, it's mostly health, because that's our big thing, but also some of the agriculture work as well. And Dangote, both philanthropically and as a private entity, is a big partner there. This food fortification, Liko's organized discussions with all the different food companies to make sure that even when the government's not mandating some of these supplementary things into the food, that that's getting started by the leading manufacturers.
I'm afraid I have only just time for another question. The deaths for malaria and AIDS were also cut in half in the last 2 decades. So my last question to you, Mr. Gates, is, will there be a cure for AIDS in our lifetime, do you think?
Yes, I'd say, even though in the short run, these incredible headwinds of debt and reductions in aid and some instability mean the next 5 years are going to be very challenging. If you take a longer perspective, where you get new research, like we are spending literally billions on the idea of an HIV cure, I think it's very likely in the 10 to 20 year time frame that these innovations will get done. We'll figure out, despite the challenges, how to get them delivered. And so that's why this work, including delivering it in Africa, is the big focus of the Gates Foundation. And you'll hear from us in January as we celebrate our 25th anniversary. We're meeting a lot, talking about, okay, what are our goals for the next phase of our work, and we're gonna set some very ambitious goals. So yes, I am optimistic on HIV specifically and on health broadly, despite the fact that we're in a tough period.
Right. And in your report, you also talk about the second global health boom and the golden age for health. Certainly hope that will come very soon. Thank you so much for being here on the show with CNBC Africa. And that was an exclusive interview with Bill Gates, the co-chair of the Gates Foundation.